Right, 21 Pilots, 105.1 The Buzz, Dari, Mitch, and Ted in the studio with Dr. Dan
I was
Miller,
Dr. Dan Miller was
cosmetic dentist.
cosmetic dentist to the.
Swell
Dr.
fella.
Miller's wife is in the studio with us right now. She looks like a younger, cuter Kristen Chenoweth kind of.
Yeah, I see that for sure.
Yeah, and she's also got that big smile.
Yeah, beautiful smile.
And yeah, that Chenoweth energy.
I guess if you're a dentist's wife, you better have a beautiful smile.
That was, prerequisite
that's a
to
really-
marriage.
that's a
Prerequisite.
really
Smile as
good
big
point.
as you can.
Yeah.
Okay.
I'll take you.
Do you find that you look at people's teeth
Yes.
like just out of?
Yeah. But they know, they're subconscious about it. So, or they think I am all the time. So sometimes they'll talk to you, like put their hand over their mouth.
Right. Or they purposely smile a lot. So
Yeah.
I tend to do that
Yeah.
to you.
Or you get in an airplane and people find that out and then they tell you like
They
the,
find that out on an airplane.
Well,
You
say
get-
what you
like
do.
the random.
Well, I mean, come on. We can all say what we're thinking. He looks like a dentist.
yeah.
Well, I was picturing what you do is you get on the airplane and before you sit down, you grab the mic away from the flight attendants and you're like, I'm a dentist. You drop the mic and then you go sit.
That
I can see you doing it.
Yeah,
It's weird.
Do you sit on planes and just wish they're going to say, we have a dental
Dental
emergency on
emergency.
board? Is there a dentist?
I feel like if I heard that, there'd be like that 3-second count where you just wait for any
Should
other
I?
dentist
Should I?
coming up, and you're like, okay, no, he's got it.
Yeah.
So Mitch had his teeth whitened.
I did. He did the glow treatment in your office. I'm very impressed.
Okay, so describe from your experience what it was like, and then we'll have Dr. Miller say what really happened.
Because I've had some bad experiences trying to do it at home. I get the zing of pain, and then I'm done. I rinse my mouth, and I was like, all right, I'll just deal with the color that I have.
The zaps.
The zaps, yeah, it's very uncomfortable. But in your office, Melina, your assistant, first she does this, puts this magical stuff on your gums. It goes on a liquid, then she uses a light, and it hardens it. So your gums are completely protected, so there's no worry of the material going onto your gums,
That's
which is because it's powerful enough to whiten your teeth. It obviously can do some damage to your gums.
You're
Okay,
right.
now I know you,
Yep.
so I'm picturing this happening to you, and here's what I'm imagining.
All right.
You being paralyzed with worry that you're somehow going to mess up this process.
Always.
Like you're like, I'm gonna scrape it off my teeth. I know I am. I'm tapping it. Oh, I'm tapping it. Is that true?
I'm always curious. Yes, I want to know what's happening. And you have a contraption in your mouth. It can hold your mouth open.
Ooh, I'm gonna bite down on the contraption and break it.
And it's the longest I've ever gone without talking.
Yeah.
I couldn't talk for an hour because this
That's
contraption in
not
your mouth.
true.
It was
What
hard.
about bucket time?
Honestly,
Oh, when I have my bucket time, I hum.
Mr. Miller, Dr. Miller, you're probably not aware of this fact, but sometimes in his house, Mitch likes to
relax.
put a plastic bucket over his head.
It's a metal bucket.
A metal bucket over
It's
his
a little
head.
isolation chamber. I can't
And
afford a
just-
real isolation
and
chamber.
just sit there with a bucket on his head.
Occasionally hum.
Sit in the quiet of his house
Find
by
my
himself.
zen.
This is whose teeth you whitened.
So once your gums
No
are
one can
protected,
see how white your teeth are under
No,
the bucket,
that's
Mitch.
true.
Right.
I know.
We'll draw the big smile on the front of the bucket.
Yes.
Okay, so then what happened?
So your gums are all protected. Then Melina starts with the procedure itself. She kind of first then she polished my teeth a little bit to kind of open up, I guess, the tooth.
That's
So-
right.
So we can
Yep, clean them all off. Make sure they're nice and clean.
Except the is it bleach? Is that what it is? The
Oh,
material?
what was she polishing with?
No, the
Oh.
actual material.
Yeah, so it's a hydrogen peroxide like derivative. Yeah,
And then it's more powerful than you would do it at home.
it is.
Obviously,
That's why we use the gum protector.
because you want a professional doing it. And then she paints on the bleach stuff, and you sit there for 8 minutes. You have a little beeper, a
Yep,
little light.
you have that little mouthpiece you put in.
Yeah,
Yep.
that's what it is. Yes, the mouthpiece. And when it goes off, she knows it's time to come, and she takes that off, and then we rinse, and then we start over.
Okay, smile. They look really, really good.
Thanks, Ed. Thank you.
Yeah,
Yeah,
they're quite white.
It's called the Glow treatment, and I highly recommend it.
Is there a type of person that can't do this?
Most people can. I would say the biggest ones that would be if you had a lot of front crowns on all of your front teeth. Well, we're not really going to whiten those and get them much lighter. But for the most part, almost anybody can. Even people that have a little bit of fillings in the front, or we've got gum recession, things like that. You're still a candidate for it. Yeah, but we obviously take a look if there's something you're interested in.
I want to know how white you do and don't go because there's a national client who I obviously won't name, but the disciples of this client
Yeah.
came in I don't think they advertise on the station actually.
All right.
I'll tell you who it is off the air.
I can't wait.
Came in to talk to the then endorsers, and she was from the Los Angeles area. And when she smiled,
It
it was like a light going off in her mouth. It
Yeah.
was the weirdest, most artificial white you've
You don't-
ever. And
yeah,
it
you
was
don't want that.
it wasn't good.
Right.
Like I understand that you want white teeth, but it was grotesque looking, and it made her look freakish.
Yes.
You want them
th-
close to the color of your whites of
That's
your eyes,
correct.
right?
So that's
Yeah.
what we end up doing
Oh.
when we're using that. We use the whites of your eyes as kind of a healthy white. That's what we shoot for.
What if you have jaundice?
Don't
Or
get your-
bloodshot
Then,
eyes.
Don't get your
then we're
teeth
just
white
going to rub dirt all over
on
it.
that day.
To find out more about the Glow treatment and the other options available at this full-service dentist, not just cosmetic work, but regular, ordinary, run-of-the-mill, boring, drudgery dentist work also.
It's a beautiful office. It'll make it less boring.
It is. Is it in Happy Valley?
Yes, it is. It's more like a spa in there, I would say. It's just gorgeous. There's a fireplace in there.
What's your website? Is it Dr. Dan?
ValleyDentalWorks.com.
Excellent.
ValleyDentalWorks.com.
Thanks, Dr. Miller.
Thank you,
Doc
guys.
Dan.
You
Doc
guys.
Dan.